Hello guys, assalamu alaikum. My name is Dr. Faraz Ahmad. So after so long I am here again with a new video regarding the PLAB to Simman station. So in this video we are going to discuss about the heart failure station. Please keep in mind, either you have heart failure station, you have asthma station, you have COPD station in your exam. All these patients will be there with the complaint of shortness of breath. So how you will come to know either this is heart failure station, either this is asthma station or COPD station? You have to ask few questions from the patient. Like out of your room, the scenario will be only this, like 62-year-old man Adam is in the room with the presenting complaint of the shortness of breath. That's it, nothing else. You have to go and you have to manage the patient. So how you will come to know what is the diagnosis of patient? You will come to know regarding the diagnosis of patient after asking the questions. Like, please keep in mind, if patient is known case of asthma already, when you will ask how can I help you, yeah, what brings you to the hospital, patient will tell you, doctor, this asthma is killing me. It's mean this is asthma station. If patient don't tell like asthma is killing me, patient tell you, doctor, I am unable to breathe. When you will take history in the past medical condition, patient will tell you, doctor, I am asthmatic. Okay, so if patient is there with the heart failure, patient will tell you in the history, yes doctor, I have high blood pressure for this time, and I had myocardial infarction like 2 or 3 years back. Okay, so if patient is giving this type of history, it's mean heart failure station. If patient gives you the history, yes doctor, I am very heavy smoker, like our patient mentioned I have smoker cough, it's mean this is COPD station. Okay, so what you have to do, like you are out of the room, there will be scenario, Adam 62-year-old presented with the shortness of breath, please go in and assess and manage the patient. So when you will go in, what you will do, for first of all, the approach is same. You have to open the door, you will go in, you will loudly say, hello examiner, my name is Dr. Faraz Ahmad and my GMC number is ABCD. Whatever your GMC number is, you will verbalize loudly. So before moving toward your patient, Simman is your patient in this station. Please keep in mind, you should be safe. What is meant by safety? Safety means either you are gloved, you are wearing your mask or not, you are safe or not, you should be safe. So as this is not an actual patient, this is a Simman, you have to verbalize what you will say, examiner, assume I have taken all the universal precautions. Okay, so you have verbalized now, and now after saying this, you will move toward your patient. So when we move toward our patient, what we do, we normally introduce our patient and we acknowledge the patient. So when I will move toward my patient, I will say, hello Adam, if I know the name already. If I don't know the name, I will simply say hello. Patient will say hello doctor. Then you will introduce, my name is Ahmad, I am one of the doctor working in this A&E. I am really sorry, like you are struggling for breathing, or you can say, I can see you are struggling for breathing. Then you will say, would you mind confirming your full name and date of birth for me? Patient will mention the name and date of birth. Okay, so after this you can ask, please tell me what happened to you. Can you please tell me what brings you to the hospital today? Patient will tell you shortness of breath, or patient can say, doctor, I am having this difficulty in the breathing. So I am working in the A&E in United Kingdom right now. So most of the time what happen, like GP refer this type of patient, and when GP refer this, give a letter along with the patient as well. So when you read letter, you can assess all the condition. So but if there is no letter, you can simply ask, what happened to you? Patient will tell you the story, doctor, I went to my GP because of this breathing problem and GP has sent me here for the workup. Okay, then you will take history. When did it start? How did it start? What were you doing when it started? And the most important thing over here is that this MMA, you have to ask about the medical condition, medication and the allergies. Please keep in mind, patient will give you the history, doctor, I had myocardial infarction 2 years back, or patient can give you the history, doctor, I am hypertensive for 5 years and I am taking this medication and this medication. And one other thing which you have to ask in the heart failure station, when patient give you the history, doctor, I have myocardial infarction or I am hypertensive, you have to ask about the heart racing and dizziness. These are the two other important questions which you have to ask in heart failure station. Okay, and one important thing which is a universal law, Whenever there is a patient with breathing problem, you have to ask about chest pain and leg pain. What does it mean? The most serious diagnosis with the breathing problem is pulmonary embolism, and patient can collapse within second. So you have to ask in every patient, either is asthmatic, COPD, heart failure, whatever the problem is, you have to ask, you have to rule out the pulmonary embolism. Okay, so patient is lying on the bed and patient is suffering from the breathing difficulty. What you will say? Examiner, ideally I would like to put my patient in semi-sitting position. What does it mean? You want to probe up the patient. Okay, then you will say to patient, Adam, I am going to assess you. I will look, feel, tab and listen to different parts of your body. Please be assured a member of medical team is with me and he or she is acting as a chaperone. Please be assured we will maintain your privacy. Okay, then patient will say, okay doctor, you can proceed. Then you first, before going toward the patient, you will look at the monitor. What happen normally whenever you are in the ED, you have to attach the monitor to patient, but in the Simman, in your PLAB 2 exam for the Simman, your Simman will be attached to the monitor. So what you have to do, you have to verbalize this and you have to acknowledge. You will say, I can see my patient is attached to the monitor, and then you will verbalize the vital, and then what you will do, you will start the A to E approach. Okay, so as your patient is talking to you, you can simply mention, I suppose like my patient airway is patent because my patient is talking to me. Or the other thing you can say, I am looking for any lip swelling, tongue swelling or the foreign body as my patient oxygen saturation is low. Then you will look at the oxygen saturation. As my patient oxygen saturation is low, so I am going to give 100% oxygen via non-rebreather mask. Please keep in mind, okay, if there is no smoker cough, give 100% oxygen via non-rebreather mask. After attaching the oxygen, you have to involve the patient in every step. You will ask, how are you feeling now, Adam? Okay, so then you will move forward. So you have done the A, then you will move to the B. What is B? B is breathing. You will do, Adam, I am going to unbutton your shirt to see your chest, to look at your chest, to feel the trachea, and you will comment on the position of trachea and tab and listen to the chest. You will simply say, Adam, I am going to unbutton your shirt to look, feel, tab and listen to your chest. When you will listen the chest, in heart failure station, you will listen bilateral crackles on the auscultation. Sometimes you can listen V's as well. So in the B, you will request chest x-ray, ECG and ABGs. If patient is VC, you can give salbutamol 5 mg nebulization with the nebulizer mask along with the oxygen. So after doing this, you will again ask the patient, how are you feeling now? So please keep in mind, in the heart failure station, the most important part is C. Most important part is C. So in the circulation, what you will do, Adam, I am going to pinch your finger to take you, and I will take your pulse and the blood pressure. Then you will verbalize, I can see that my patient blood pressure is normal, high, low, whatever the blood pressure is, you will verbalize, and then you will verbalize as per the pulse as well. Then you will say, I am going to insert one large bore cannula into your vein and I will take bloods. So you have to mention the investigation's name over here. Take blood for the routine blood investigation for the BNP. Please keep in mind, this BNP is very, very important in the heart failure station. Mention the cardiac enzyme, mention the infection markers as well. Okay, so one important thing which you have to keep in your mind is MONF. As in the ACS station, like chest pain station or the myocardial infarction station, we have to keep MONA in mind. So in heart failure, you have to keep MONIF in your mind. MONIF mean, M mean morphine, O mean oxygen, N mean nitrates, and F mean furosemide. So we have given the oxygen already. So what we will do now, we will give the diamorphine. So in the heart failure station, please don't forget diamorphine. You can give 1.25 to 5 mg IV slowly. The most important thing in the heart failure station is furosemide. Then you will go for the 40 mg of the furosemide, and you can give GTN spray 2 puff. Only you have to give the GTN spray if blood pressure is more than 90. If blood pressure of patient is less than 90 systolic, please don't go for the GTN spray. So after doing this MONF, you will ask, how are you feeling now? Hopefully your patient will get stable at this point. Then you will say, Adam, I am going to explore expose your front passage and your legs, as we have to pass a catheter into your penis to monitor the urine output. As you know, we have given you an injection to produce more water, which will help in resolving your symptoms, and we have to monitor your urine output, so this is necessary. Private area and particularly your legs. I would like to see any leg swelling, any redness on your calf, or any tenderness in your calf muscles. So after doing this, hopefully your patient will be stabilized. Then you will move toward the plan. So once the patient is stable, then what you will do, you will explain the condition and management which you have done till now. You will explain to Adam, as you presented with the breathing difficulty today, and in the history you mentioned that you had myocardial infarction 2 years back, or you have hypertension, and you are taking this medication for the hypertension. So from your condition, after my assessment of your chest, after doing the x-ray and after doing the ECG, I was suspecting that you are having a condition which we called as heart failure, or you can say pulmonary edema. So in this condition, what happened, because our heart is unable to pump the blood properly, so because of this failure to pump the blood properly, the fluids start accumulating in the lungs, and because of this there is fluid in your lungs which is causing the breathing problem. So I have given you multiple medications, including for the relief of your pain, for the relief of your shortness of breath, and I have given you the injection for the water. Like this injection will help you to reduce the water from your lungs, and this excess water will be excreted in your urine. So after this, you will explain, we are going to admit you in the cardiology ward or the medical ward. I will involve my senior, we will involve the heart specialist for the further management, and we would like to do the ultrasound of your heart to check the functioning of your heart. Then you will give the advice for the triggers of disease. You will safety net the patient for the allergen compliance, inhaler techniques, or the compliance to the medication of the hypertension or the MI, and then you will give the safety net for the worsening symptom as well. So that's all about the today's video. If you have any questions, you can follow me on Instagram. You can ask me in the comments box. I will try to reply to your comments and the messages. Thank you very much.